Hey guys, this is Dr. Jean-Guy here, and today I would like to give you a little education here on orthotics. Lots of people wear orthotics. Maybe you know people that are wearing orthotics, maybe you don't know that. What is the difference between an orthotics versus a heel lift versus a sole lift? My goal today is to take a few minutes to answer those questions because most people are not clear about it. They don't know what would be the benefit. They don't know how it's being done and what would that do to you and what potentially could you benefit from it. So just to start, at my office, some of you here have been around for a while, so at my first office we used to have some carpeting into the office, and you know, I was on my feet 10 hours a day and everything was fine. I've never had any issues with my feet. When I moved to our new office here in Frando, our current office right now, we have some bamboo floor, and shortly after that started to have some pain in my feet, and also to have back pain. And I was just wondering here, what has changed, and obviously, the flooring had changed. So what we did is at that moment in time, I just got connected with some friends that have a specialty in foot posture and in spinal biomechanic, and then I got interested into learning more about it. But for me, that was really a game changer when I had custom-made orthotic being designed for me specifically, right? As you can see this, they were specifically designed for me, and as a result of that, right from that moment on, from the time I put that in my shoes, it was just like a complete game changer. But I've been doing some casting for custom-made orthotics for a long time. Not many people know that. The technology and the science behind it has gotten so much better. Now we do this, we mechanically engineer with a scan. I don't know if you can see this here, but you can mechanically engineer with a scan exactly what the foot posture is in a 3D, and then you can build a custom-made orthotic specifically for the person based on their weight, and then it will just be perfect for the foot posture and reestablishing perfect foot posture. And it's likely not going to be the same on both sides. However, right, it's going to be done exactly the way that it needs to be done for you. And what is the benefit of that? The benefit of that is, well, many times is people's going to start, like if you had some bunions, like my mother having bunions, as soon as she started to put the orthotics in, her big toe that was curling in started to get back to be straight again, which was truly amazing to see that. I also have seen people with knee pain that the knee pain would just go away, because what happened is when the arch collapses, it will just rotate your tibia inward, and it will rotate your femur outward, and then it will have the tendency to shift your hips forward. So as a result of that, it has an impact all the way up the chain. So people that have foot problem, or you can also have, maybe you don't have quote-unquote feet problem, but you have knee problem, or some people even have low back problem. I've seen people putting a custom-made orthotics in, and within 24 hours, their back pain was gone. Now, it just did not mean that all the underlying cause was taken care of, but as it relates to their pain, it was huge benefit. So what I want to say to you today is, if you don't know anything about custom-made orthotic, that might be something that you might want to look into, especially if you have had issues with your feet, if you've had issues with your knees, with your lower back, or a combination of those, and you don't know which one comes first, chicken or the eggs. Also, a question that I have to answer frequently is, people ask me, what's the difference between what you do, Dr. Jean-Guy, and maybe what the foot doctor does? In my experience, oftentimes at the foot doctor, they will make orthotics. However, the plastic that they use is really, really hard, like it's cement hard, and the foot does not give at all. And as a result of that, oftentimes people don't do well with it. So I've had my orthotics now for 10 plus years, the same pair. Unless you gain 100 pounds or you lose 100 pounds, it will be good, depending how much of usage that you have. But I wear them every day, and I've never had any issues, still have them today. So that is a custom-made orthotics. And now I want to give you kind of what's the difference between that and if a person has a short leg. Now, if you have a short leg, that means that you have something that is shorter on one side versus the other, a leg that is shorter on one side versus the other, then you might need to have a sole lift, meaning something that you would put underneath the orthotics in order to level out your hips and your lower back and your sacrum, your tailbone. That is completely different from an orthotics. The orthotics, you wear that on both sides, but the foot lift or the heel lift, you would only do that on one side, right? So that is the difference between the two. Is there's some confusion about that of like, who would you give a heel lift versus a sole lift versus an orthotics? So when we evaluate a person, then we would evaluate to see if there's any issue with the foot, if there's any issues with the knee, with the hip, and then we take all of that in consideration to make a clinical decision of how it's being done and what would be the best approach, and that would benefit you the most. So I just want to spend a little bit of time today to explain that to you, because most people yet don't know that we do that. I've done it for a long time. However, earlier in my career, I did not do a whole lot of them because the technology behind it, to be able to have this, to be able to repeat it from one person to another, was not as good as what we see today with the ability of, building those, mechanically engineer them specifically for the person and knowing 100% of the time that it's going to be right for that person. So we're really excited. I'm really excited to share that information with you. So if you think that if this is one of you out there, or you have, your kids or, pregnant moms, or just you work on your feet all day long and you're like, hey, I don't know if this could benefit me, you know what? Just call our office. You can just click in the link below here to connect to, our website or our phone number. Matter of fact, I'll give you my phone number. It's 517-336-8880. You can give us a call, schedule an appointment, and we can evaluate you. Or you can go on our website and you'll be able to connect as well. So, and I'll be more than happy, and one of the doctors, be more than happy to evaluate you, tell you exactly what the possibilities are, the needs that you have, and what would be the best, the best way to correct the problem that you have. So ultimately, we're here to help you and for you to know what's possible. And I just want you to know that, ultimately, you are designed to be healthy. You need to be mechanically sound in a gravity environment, and when you're not, your body will break down 100% of the time, right? So we just got to find out from the bottom up to make sure that everything is working the way it should, and you're mechanically sound in a gravity environment. Your spine and nervous system is functioning properly, and then that, by having your foot on the ground, if your feet are on the ground, they're uneven, or things are not the way that they should be, it's obviously going to have an impact all the way up. So just thought I'd share that with you today. Hopefully you learned something, and we'll talk to you soon. Take care.